Breaking news. Actually, burnout is real. I have many patients in my practice who are either on the burnout spectrum or fully on a burnout sick leave from work. And these are all women, of course, because I have a female focused practice, but all women who are very driven and very hard workers. There's often this perfectionist aspect to them too, but it's the women who just push until their body gives up, basically. It's not that finally one day they decide cognitively that they don't want to continue with this unreasonable workload. It's that their body starts to give way and they have physical symptoms, but there's also emerging research that shows that there are distinctive changes in the anatomy and the functioning of the brain. So even if this woman's personality is the same as it was as she was leading up to burnout, she can no longer cognitively nor physically function in the same way. So there's a big challenge here to get them back from burnout. One, physically, we have to make sure that their nutrients are up to snuff. Usually there's some kind of iron deficiency or vitamin D deficiency or some complexity there. There might be a thyroid imbalance or something else that's going on at a deeper level. And so we correct all of those things. And ideally, if they have time off from work, they can take that time to restructure, to kind of get things off of their plate that they don't need anymore, set up meal delivery service, hire a cleaning person, get more support from their family, their spouses, so to just set them up for success going back. But then there's always this cognitive or psychological aspect that's the trickiest to do. It's that she cannot let go, right? She still wants to do all the things. She still wants that big job. She still wants to, bake the perfect birthday cake for her child. So letting go of that is, up to the woman. It is very difficult for her to make any long-term changes without having a shift in what her definition of success is. And for a patient that I had last week, she was continually having these burnout leaves from work. And she really does not have the capacity now to do all the things that she can do, given that she has a high needs child and a high needs job. And so I was trying to get her to just consider for the next 5 years, not making her job the priority, but really seeing herself as this 100-year project. She has a young, high-needs child now. Their needs will reduce over time. So can she consider just altering her career temporarily? And in an attempt to find some kind of research or literature to support that, to give a second opinion to mine, I found a study that showed that in the Netherlands, 76% of women work part-time. And of those, only a third of them have small children. So there is this cultural push that we have in North America to push, right? To do everything we can. It's not full-time work, it's all-time work. There's zero downtime in these scenarios. So the best root cause approach would be actually doing less of that, right? Being okay with downtime, being okay with nourishing other aspects of our life that aren't child related and work related. So that's usually when we refer to a psychotherapist, especially one that's focused on burnout, and they really work through what's the self-worth around work relating to, and what can we look at that goes a little layer deeper than that. So really bringing a woman back from burnout is very multifaceted. We have to get multiple team members involved. We have to get her to look at herself from a very external objective perspective and see what's going on with this project, what are the areas that are needing improvement, and what tangible steps can you actually take towards that.